My name is Olukemi Kuku, and I am going to be presenting my capstone project that I've been working on since the beginning of the year. And it is going to be concerning the problem, one of the problems that we have in our area. It is on new graduate nurses, baccalaureate nurses who are having challenges in the workplace. And so the topic of the project, I titled it Fluid Passage, Setting Up New Nurses for Successful Transition. And this capstone project marks the ending of our graduate nurses program where we become leaders, change agents in the community. And I am glad that I am finally able to address an issue that's been burning in my heart. So, to the presentation. Topic, fluid passage, setting up new nurses for successful transition to practice. The problem that we have is that new nursing, new nurse graduates, even those who have excelled in their competencies, passed their NCLEX at the first go, it has been documented through research that when they go to the field of practice, they face a lot of challenges, and about 30 to 60% of them nationwide usually leave their first job within the first 3 months, and some of them actually leave the nursing profession as a whole. And this phenomenon has confounded researchers. Organizations have tried to solve it by doing multiple orientations, intensive orientations, but it is not because knowledge is lacking for these graduates. That is not why they get frustrated. The gap that exists between the academic walls and the reality of practice environment is what causes them to become frustrated because their expectations do not match what they see in reality. And this gap has been labeled reality shock, transition shock, adjustment strain, depending on the discipline that is addressing it. Psychology has, sociology has, and nurses have. And the problem still persists. In my geographical area, in my local area, it is a real problem for us, and the turnover is causing an acute shortage and also impacting the population health. So how relevant is this problem that I chose to address? Well, in my local area, the high turnover has a lot of economic and health implications. First of all, the burden of disease in the population, because with shortage of nurses in the last 5 years in this area, we have had 2 hospitals downsize, and so many small hospitals have decided to merge or reduce the services that they provide. And what has um, happened as a result of this is that patients show up in the late stages of their disease. And also it causes, there's the continuity of care is impaired because the nurses come and go. And so what I have done is that I am trying to propose a culturally relevant solution to the problem that is local to our area. What is reality shock, transition shock, or role adjustment strain? I did mention all these three um, phenomenons. I've mentioned them in the last slide. Well, reality shock is a social phenomenon. Our nurses that are facing this problem that we are discussing are diligent, well-prepared nurses in the cognitive area. Cognitive, they have done very well. Skills acquisition, they have mastered their competencies, and NCLEX has declared them fit to practice. Then why do they have these feelings of anxiety? Why do they have these um, frustrations when they go and practice? And my theory is the problem that we are having is a psychosocial problem, because what has happened is after the Institute of Medicine in 2011 had emphasized quality of care to be safe and to be of high quality, we have made developed these competencies, and we make sure as nurse educators that these competencies are well taught and that the students learn it very well, and we're doing a very good job. But one part that has gone a little bit to the background, we do address it. I must say, we do address it. But one part that has gone to the background is the emotive process, the psychological development and coping strategies for our nurses as they are going into the field. We have not emphasized that enough. And so what happens is that when we graduate these nurses, they go to the workplace. Rather than have the one patient that they had at their clinical rotation, they're presented with 6 patients, and they are presented with pumps that are not working, and they have to use their critical thinking skills to think out of the box. And then they have to experience the bullying, and sometimes they experience the real world where the sick patient does not want to be taken care of by them. And that confuses them, you know. So when that confusion meets with the personality of the person, so they have a role to play as a nurse. They know their role is a nurse, but say their identity as the nurse starts to diminish and their perception starts to move to the negative side. And that is what causes the frustration for them. So I'm addressing this issue more as a psychological issue that needs to be developed before we send our nurses out. So the reality shock and transition shock and role adjustment strain is a psychological phenomenon that happens at every stage when you experience a role change or life change purpose. They are moving from students to professional, and that is a role change. And that goes with identity. So that is where the confusion comes from, and that is where the gap between academic and practice is. And that is what I am trying to address. Please watch this short clip. There we go.
Nurses eat their young. How many times have student nurses heard that, or other horror stories about how they'll be treated when they enter the workplace? Yet, men and women still want to enter the profession. They enter colleges or universities with the hope that they'll graduate and have a wonderful orientation with a preceptor who has excellent clinical skills, is kind, compassionate, empathetic, and respectful, and imparts those qualities onto them. But unfortunately, this seldom happens. 30 to 35% of nursing graduates leave in the first year, and up to 50 to 57% leave in the second year. Is it because they were ill-prepared in school, or because they felt they could never master the skills they were taught, or were never shown how to do them the hospital way by their preceptor, or because they were never befriended by other staff or made to feel part of the team? or because they never had support from management, or because they felt bullied, belittled, or set up to fail.
So those are questions we have in a student-centered environment like we give our students. We have let them know that they are going to make it. They're not set up to fail. But when they get to the practice environment, the situation says a different thing to them. Okay, so that is you've I've given you the gist of my project. So the aim of my project is to incorporate psychosocial competencies into nursing curriculum by as a means of equipping the new graduate nurse with strategies to cope with professional role in practice. So I chose a traditional school of nursing as my project setting. It is one of the leading nursing schools in the area. Actually, is the fourth of in the list of the best nursing colleges in the state. And I also chose as my audience the incoming nursing students. It's the first semester for them. They've not had any nursing classes, only pre-nursing courses. And so they are in their first semester of their first year. And the reason, the rationale for this choice is that I want to say that these strategies have to be taught at age appropriate level for each of the four levels of the nursing school. That is, these are competencies that need to be built on at every level. And these are the theories that influence my my project. That is a seminal reference. And Dashna is still working on her project. It's going to be 25 years this year working on the same thing. I went to the to sociology fields to borrow their role modeling and relationship from Bandura. And then the role strain theory is an organizational role theory that I borrowed from the field of athletics as well. So on this slide, basically what you saw are the theories that influenced my project. I went outside the field of nursing because I feel the fields of sociology and psychology have a lot to offer us in the area of relationships. And here's a list of more scholarly works that influenced my project. I particularly paid attention to Watson's Caring Science, which is basically, in a nutshell, Watson says, heal the healer. These nurses and us, we are the healers. If we are whole and we have a holistic perspective, then we will give better care because we already have the tools for the better care, but we have to be in a well state to be able to give the care to somebody else. The process for my project was very simple. I found a mentor in the faculty. I discussed my project or my thoughts with her, and she did give me a little drill at the beginning to make sure that I was committed to lifelong learning and excellence in nursing because she is a veteran known for excellence in nursing. And upon finding out that I was really passionate about this topic and about excellence in nursing, she introduced me to the faculty and the semester team. In the project setting, they work in teams and they also do team teaching. Every unit, you have more than one educator teaching and also doing the lab skills, but they are done together. So they do have a lot of meetings, and I was able to be present at those meetings. Um, I had wanted to use the ideal flipped classroom for the project, but college policies did not allow that because students have to have a certain number of lecture hours. So I ended up posting my lecture notes so the students were ready to class, and I had a face-to-face lecture in an interactive format. And we held labs, and then after they have had 3.5 hours of lab practice, then they do a return demonstration on which they are graded with rubrics that they already have. And while they were doing the rubrics, my rubric for my project, which is the psychosocial competency, was not on the rubric because they do not ad hoc change anything. Everything's done through voting and meetings, and committees are set up. But what they did was, under the cues and values, knowledge, skills, and attitudes, under the attitudes, I was able to coach the students on real life issues, real life situations that could occur. In the process of the project, I also collaborated with the Learning Resource Center. They made me aware of the approved technology for the college, and I stayed within that framework. Project outcomes. I believe that my outcomes are significant. Faculty awareness has been heightened. Of course, everybody knows that this problem existed, and but my having the project at the School of Nursing brought the issue to the forefront. Psychosocial competencies. After I introduced my project and what I was going to be doing and what my intention was, they got on board, and some of them offered me their services if I needed any help. And they really modeled to me mentorship. And seeing that they do understand that, I can see how it is possible for us to be able to revise the curriculum in the near future. During practice times, I saw our students unwind and relate professionally. And from time to time, we did shift them around so that they don't have the same partner, because in the real world, you don't have the same partner every day. And I also introduced reflective blogs for discussion at the end of clinical. We did it like post-clinical, and a student survey has been completed. The analysis of the survey has not been completed, however, and my mentor report will be completed at the end of the project assessment. And like I said, the goal of my project is to provide holistic nurses to treat patients in a holistic manner. Project significance. For the organizations, the main thing is that they will be able to have a decrease in nurse turnover and that their systems will run better. I also know that with decreased turnover, then funds can be used to improve employee learning, employee interaction, employee education, and also for equipment as well. Also, what I have introduced to the department is that as we are trying to get these nurses prepared for practice environment, that administrators and nurse managers should liaise with our nurse educators. Some of that is already going on, but just not in the area of what I am looking at. So academic partnerships will develop within the nursing faculty and administration of hospitals. Overall population health will improve because our mobile units that go to the rural areas will be well staffed and they'll be able to go out again. For me, there are some personal significant issues that I have, not issues, not problems, but there's been some personal development as a nurse leader and as a role agent. And I did see myself actually during this project acting as a change agent, a collaborator, and someone who is using the skills of cultural competence. And this project has given me an opportunity to see another culture different from the one that I was coming from. I do know the culture and the education department at different hospitals, but seeing the academic environment, I knew that's where I want to be. And so through this project, I did get some socialization to nurse educator roles, responsibilities, and relationships. And of course, it has increased my passion for lifelong learning, knowing that I will be able to help, some people fulfill their dreams by preparing them well, talking about the students. And also, through this Capstone project, I now realize the value of mentorship in nursing. So that has been my journey since I believe I started the groundwork October of 2017 when I started looking for a place where I will be accepted to do my project. So that has been the journey, and you have, in a nutshell, got the report of the project. And I just want to say that I am glad that we went through the program that we did at Excelsior. It is certainly a great one. And to my instructors, to my faculty mentors, to the advisors that I call almost every week, and to my mentor, and to my colleagues, my peers in the classroom, I just want to say thank you. And I am very glad to be a nurse. Thank you.